So it can be a matter of a bit of a tug of war, but it is a good practice to ensure that the house is well ventilated so that you get rid of what has been in the interior so that it goes out and new air can circulate inward as well. So ventilation also very important, whether at home, like in the places where we live, but also in the places where we work. Another cause for problems with air quality is the presence of pollen and molds in the air. So this usually will come from plants and fungi. So certain times of the year, especially when a lot of plants are flowering and grasses as well, you can have a very large, high volume of pollen in the air. And in wet, moist places, we can also have a lot of fungal spores or mold spores in the air. And these can also reduce the quality of the air, especially if we are allergic to them. So these types of pollen and spores can cause allergies, and the allergies can result in inflammation. We'll talk a little bit more about that in another section. Then some home care and personal grooming products can also exude harmful perfumes or fumes, as well as residues. These can actually also contribute to reducing the quality of our air. So we should look at what we use for our personal grooming as well as for cleaning our homes. And that is one reason we always recommend that we use the Neolife home care range as well as the personal grooming range, because they all are manufactured keeping in mind that we should not have them increasing fumes and residues in our homes and in our environment also. Then apart from air quality, another cause for concern in the health of our respiration is how we breathe. A lot of times we breathe automatically and we don't really think about it. And of course, that is normal. But it is actually how we breathe is an important component of respiratory health. It is important that we breathe through our noses rather than our mouths. We can have cultivated the habit of breathing through our mouths, which is not actually recommended. This is because the nose is especially suited to filter out impurities in the air and to enhance the volume of air we breathe. And you may notice that, especially in older people, that there are quite a number of hairs in the nose. And we tend to be a bit not comfortable with these hairs, especially when they grow very long. But they do have a purpose. They filter out dust particles and other particles as we breathe in. And this makes the nose a better inlet for breathing in than the mouth. How can we improve our breathing then? So the first is to get in the habit of breathing out completely. A lot of times we think more about breathing in and less about breathing out. But breathing out is also very important because we need to expel all the carbon dioxide that is in our system each time we breathe out. And then we also should cultivate the habit of habitually breathing deeply and slowly. A lot of times we also don't think about this and don't do it. So we should try to get into the habit of breathing deeply whenever we remember, and we should try to remind ourselves to breathe deeply. I know we do this, for example, when we are agitated or we have got a situation, but it is actually a habit we should carry out throughout our day, because that ensures that we fill our lungs to capacity and expel all the carbon dioxide that is in our lungs. Then we should maintain a good posture. So this is another area where we can see how we are doing and try to improve. So we should avoid slumping, that is sitting with our chin moving towards our knees, or slouching, which is with our sitting back and drooping our chest and our chin into our chest. or hunching, which is folding ourselves over our shoulders. So all these positions compress the chest cavity. And remember, our lungs are inside the chest cavity. So for us to breathe well enough, we need to sit upright and practice the habit of maintaining a good upright sitting posture so that we allow our chest cavity to have the right volume for our lungs to expand to capacity when we breathe. We should also think about our posture when we are sleeping. So the best position for sleeping is to sleep on one side. Then we find that we are less, we have less of a tendency to snore, as well as to reduce our lung capacity. So if you are in the habit of sleeping on your side, then it is the best one recommended. But of course, some of us sleep on our backs and some of us sleep on our bellies, both of which are a bit more difficult for breathing well. So see if you can train yourself, maybe by putting a pillow behind your back to help you stay sleeping on your side, or by simply turning yourself on your side as you're about to go to sleep, so that you can start sleeping on your side. Drink plenty of water, because our gaseous exchange takes place in solution, and in fact, all of our physiological processes take place in solution. So it's always good to ensure that we are adequately hydrated. Of course, we don't recommend a specific amount of water. Some people need more, let's say, because they tend to sweat a lot more, or they live in a very hot environment, like some parts of our continent. Some people sweat less, or maybe live in a cooler place. So the amount of water we should each drink is subjective, but none of us should find it okay to drink little or no water. So water has to be an important part of our fluid intake. Then aerobic exercises help to exercise our breathing system and helps us to improve our breathing. So maybe cultivating doing a 20-minute aerobic exercise maybe 3 or 4 times a week is a good thing. Maybe you can go for a brisk walk. You can use a skipping rope, a trampoline, swimming. All these are different types of aerobic exercises, jogging, and so on. All these are useful. So you can choose the one which you find you prefer, because the important thing is to do something which you can consistently do. Then resolve stressors and stress, because these can also, when we are stressed, we tend to breathe quickly and shallowly, which means that we are not getting the full lung capacity of air. So maybe when we are stressed, a good practice is to slow down and take then do the counting breathing, so that we ensure that we are supplying ourselves with enough air and getting rid of the carbon dioxide that we want to breathe out. Then one of the concerns that there are for respiratory health is habitual mouth breathing. So getting in the habit of breathing through the mouth. This is an important obstacle to healthy breathing. So it's something we should take into account and try to get out of it, and to help our children to get out of this, because it's a habit that can start when we are still quite young. And what can be the causes of our getting into the habit of breathing through our mouth? It can be that the nose is blocked because of allergies. So, because allergies, when you have an allergic reaction, it tends to cause inflammation and swelling, which might make the nose blocked and thereby make it difficult to breathe through it. Or maybe when you've got a respiratory condition or problem, like maybe you have the flu or a cold and so on, this can temporarily cause blockage of the nose. But of course, once we have recovered, then we can get back into comfortably breathing through our noses. Another cause can be blocked sinuses. So sinuses are air passages that are found in our skull bone behind our cheeks. And this can also be due to allergies and inflammation. which cause swelling and make those air passages that are in our sinuses become narrow. And that makes you can have pain on your face, and you can also find that you struggle to breathe through your nose. And also it can contribute to snoring. Another issue that can lead to habitual mouth breathing is dental issues. Maybe that our lips don't quite cover our teeth, and for that reason, we are not able to keep our mouth closed, especially when we are sleeping. And this can lead to mouth breathing. Other things can be swollen tonsils or adenoids. The tonsils are small little organs that are in the back part of our mouth and our tongue. When they are swollen, they too can be swollen and can become infected as a result of an infection where the germs hide there. Maybe we have had a sore throat and the germs are hiding there, or we've had a flu and so on. And this can also contribute to swelling around the air passages, which can cause us to prefer to breathe through our mouth. Also, there can just be abnormalities in the way that our passages are, and that could be something that is congenital, which means that you may have difficulty breathing through your nose. That is maybe something that you might require to be checked if you have always had difficulties breathing through your nose with your mouth closed. Then it might need you to be checked by a specialist like ENT specialist who can check if the passages are all okay. So why are we talking about breathing through the mouth as a problem? Because we do know that people can breathe quite okay through their mouths. But some of the problems that are associated with breathing through the mouth will be, for example, smelly breath. Because our mouth is continuously open, it can lead to that. It can also lead to dry mouth and lips. So dry mouth, because the air is continuously passing through and the mouth is not so well suited to keeping itself moist. The air is not as well filtered when we are breathing through our mouth. And again, breathing through the mouth, as I said, can contribute to snoring. Snoring can also lead to poor sleep. And so there is a condition called sleep apnea, where there is repeated stoppage of breathing during sleep. So in deep sleep, a person might periodically stop breathing. This is actually a very dangerous for your breathing health. And so it may require that you consult with a doctor to see how they can help with sleep apnea, because it really leads to interrupted sleep and bad sleep. And the worse your sleep is, the more the apnea becomes worse. So for these reasons, I think that we should cultivate the habit of breathing through our noses rather than our mouths as much as possible. If we have difficulties, then we should see how we can get rid of the problems with our nasal passages, so that we are able to breathe through our noses rather than our mouths. So what are some of the things that reduce the effectiveness of our respiratory system? They will include what I've already mentioned: inflammation of the air passages. This can be as a result of pollutants which cause allergies or inflammation. So this would mean that in our lifestyle, we should check whether there's something contributing to this inflammation, apart from infections, of course, which occur from time to time. But also habits like cigarette smoking, or being habitually exposed to cigarette smoke, can also jeopardize our healthy respiratory system. And so we should look at that. And more especially if the ventilation in the place where we are exposed to cigarette smoking is also poor. Then obesity is an important factor, together with bad posture and shallow breathing. So all these are things we should keep in mind. If we have picked up weight over time, we should work towards going back to a healthier weights. We should also, as I said before, maintain good posture, whether we are sitting or standing, or even, as I said, in sleep, we should try to sleep on our sides. Then cultivate the habit of deep breathing. And if we have respiratory illnesses, some of them tend to be chronic. And so if we have chronic respiratory illnesses, there are some products we are going to recommend just now to assist. And also, if we are in very high altitudes, we can also find that we are not able to breathe very well. But most of us don't permanently stay in high altitude places. So that might not be a point that is very relevant. Just to be aware that cultivating that habit of breathing well is an important part of respiratory health. Now, let us look at some lifestyle points. First of all, we should have a diet that has plenty of fruits and vegetables, as well as herbs and spices. This will assist with the health of our respiratory passages. Then, where possible, we should avoid the environmental pollutants and toxins. I think we mentioned that. For example, use the Neolife Home Care, which is formulated with the intention of not contributing to toxins in our home environment or our greater environment. Then ensure good ventilation, even at night. I know that this is often a difficult question when we are thinking about security and so on, but try to see how you can plan so that you are able to at least leave windows open, open to a certain degree to get some air circulation. Here in this part of Africa, sometimes it gets very cold, so all windows have to be tightly closed. But maybe during the day, we make sure that we open the windows to let in fresh air. And at night, to leave a small opening in the window just to allow air circulation to take place. Help children to get in the habit of breathing through their noses. And also spending time in the sun is very important. Vitamin D is an important contributor to our respiratory health. Then looking at the supplements that we can recommend with people for our healthy respiration, we have supplements that can optimize the health of our respiratory system and to cope with some of those challenges that we have mentioned. I'll start with omega-3 plus, which helps in fighting inflammation in the body, and which, because inflammation can very much affect the air passages, making them swollen and irritated. So omega-3 plus will play an important role. Vitamin D or A plus D, also another important one for reducing our susceptibility to respiratory illnesses or recovering from them. This more especially if we live in a region where the sun is not very strong and we have a dark skin, or if as our lifestyle, maybe our work situation requires that we spend time indoors for long periods, thereby making us not able to get enough sun exposure, then we should keep in mind that we need to supplement with vitamin D, vegan D or A plus D. Another important supplement for our respiratory health is vitamin C. I will include here flavonoid complex as well. And you can take both or pick one, because remember, flavonoid complex also has an amount of vitamin C in it. And these are used by the body to maintain a healthy air passages and repairing of damage to our respiratory tissues. So vitamin C or flavonoids, quite important also. And we have a herbal preparations specifically for this issue, because you'll remember that our founder, Mr. Jerry Brasfield, had problems to do with asthma, which is actually the story behind how he founded the Neolife company. So herbal respiratory complex is a very important herbal preparation that helps to keep the air passages clear and also in good condition. So we can recommend those for young children. We recommend that they use VitaGuard and Chewable All C. especially if they are struggling with the respiratory illnesses. I remember when our children had started going to school, it became almost a chronic situation that we keep on having this run of respiratory issues through the house. And also because we do have a tendency, I and some of our children have a tendency to allergies. So for children, VitaGuard and Chewable OC, as well as omega-3 minis, can be helpful. If they are having serious problems with their respiratory system, you can give them a half dose of the herbal respiratory complex also. So with the few minutes I have remaining, I wanted to speak a bit about a condition which has become very common and I regularly receive questions about, and that is asthma. So asthma has become quite a common thing. And some of the things that have increased, some of the factors that have increased our risk of being asthmatic is number one, urban life. So urban life has the air, especially in urban areas, contains many triggers of asthma. So if you have got a genetic predisposition, it increases your risk of actually developing asthma. Things like pollution, low sunshine exposure as a result of spending a lot of time indoors, and so on. This can contribute to increasing the risk for asthma. But remember, it's something that also there's a genetic component to it. So remember, we always say you may have the genetic component, but what pulls the trigger is going to be your lifestyle. So if you're living in the city, this can be contributing to the problem. Another thing that can contribute is a poorly developed immune system due to excessive hygiene. Many of us have now become a bit obsessive about, especially since 2020, when we were using all this, I forget what they are called, all these things for cleaning our hands and what are they called? Anyway, you remember all these fluids and gels that we were using for cleaning our hands, which were killing the viruses and killing the good and the bad all together. So that has contributed to weakening our immune system and disturbing our immune system so that we tend to overreact to things which are not actually harmful. Another factor there will be excessive use of antibiotics. Some people, when they go to the doctor with an infection, they always feel that they have to be given antibiotics. So if, for example, if you've got a viral infection, antibiotics are not going to help you. So it will just be ruining your friendly microbes and giving you no benefit. So if a doctor does not give you antibiotics, it does not mean that he is being careless. It simply means that the particular infecting agent will probably not, things like malaria, you should not get antibiotics for malaria. You should not get antibiotics for flu and all this. It can contribute to breaking down of our immune system. So get antibiotics when it is necessary. And then another contributing factor is that we are having higher rates of obesity, and this is associated with higher rates of asthma. So maintaining a healthy body weight is important in many aspects of our health. And here we'll mention especially childhood obesity, which is becoming a lot more common than it ever has been, especially here on our continent. So we should look at our diet and the amount of activities that our children are able to participate in order to help them to maintain better body weight. Remove if your child is picking up weight or if you have a tendency to pick up weight in your family, help your child by ensuring that you eliminate refined carbohydrates and excessive carbohydrates in their diet. Too much screen time and being indoor too much, all these contribute to the issue of childhood obesity. Then there are many types of allergens, as I had already mentioned, and I just wanted to mention that nut allergies are also becoming common, and they are also linked to asthma. So if you don't react well to nuts, then you might find that it wasn't the asthma. Maybe another point I wanted to mention here is if a baby is born prematurely, their chances of asthma is also increased. The risk of asthma is increased. If they are born with a low birth weight, And also, if they are not breastfed, these can all contribute to increasing the risk of asthma. So the lifestyle we opt for we should try to identify triggers and avoid them where possible. And then we should get plenty of sun exposure and avoid problematic foods. If you have a tendency to have asthma in the family, avoid foods like dairy, gluten, especially non-fermented dairy. Fermented dairy is often not as problematic as fresh dairy. Then wheats can also be problematic for some people. And as I've said, nuts can also be problematic for some people. So look at what could be triggering by doing an elimination diet where you remove something and see whether the symptoms improve or the asthmatic attacks reduce. So the supplements we recommend will be for a child, VitaGuard, omega-3 plus minis, which are easier to swallow. But remember, as I've said before, if the child is not able to swallow the capsule, then it's better to buy the bigger pill and pierce it and squeeze it into their food or drink. Then we also can add their herbal respiratory complex, a half dose for children under 10. And then vitamin A plus D, which is a tiny capsule that can also be added for that recommendation. For adults, also we recommend omega-3 plus, we recommend vitamin C or flavonoid complex, as I said, herbal respiratory complex, vitamin D or A plus D, as well as magnesium complex. These can help with improving people who are living with asthma. And as I've said, it's becoming a common problem for many of us. But with good management and taking care of some of those points, you can find that you greatly reduce the attacks that you get. So I see my time is up. So let me thank you very much for having spent the time as well as the data to attend today's training. Of course, we have not yet finished because I'm about to hand you over to Pascal, who is standing by to take you through the second half of this session. Thank you very much and have a good evening. And I look forward to being with you again next week. Good night. Here's Pascal now.
Thank you very much, Betty, for those